So I am very excited to have this conference and this panel, and for the many months leading up to this while we were organizing it, I was very, very excited specifically about this panel because it is very, very unusual to get an opportunity to speak to doctors and medical doctors who actually have the full experience of the medical world and yet also have the knowledge and understanding of whole food plant-based nutrition and a lifestyle approach. So I'd like to begin by, I'd like to start by asking each of you to just, for anyone who, you know, there are people who might not watch this entire video in full, and for people that you have one chance to speak to and you want to tell them what your message is, you've been writing books, you've been doing this for many years, if you were going to sum up the basic of what your book is about, what your philosophy is about, what you want them to know about health and nutrition, what would you like to take, you know, in 3 minutes, what would you like to say to all the people that have never met you and what you've learned in the last, all these years, your philosophy? If you could each give an introductory 3-minute comment, that would be a great way to start.
In medical school, I learned how to diagnose and treat hundreds of different diseases, and I thought I was going to be seeing 6 cases of leprosy every week, 4 cases of smallpox, 3 of typhoid fever, and 1 of Tsutsugamuchi fever. In 45 years of medicine, I've not seen any of those diseases, thank heavens. I've spent my career treating a rather small group of degenerative diseases, obesity, high blood pressure, diabetes, and a host of problems from clogged arteries and inflammatory reactions of all types throughout the body, autoimmune diseases, colitis, etc. And the current dogma is etiology unknown, or some we don't know, or some subtle virus might be at play as the cause. In all these years, it's become very obvious that the cause is summed up on 3 words in a plaque in my office. It's the food. And the second line under that is, it's been the food all along. In the space of our careers, my career, the American diet has devolved and become toxic. And every 4 or 5 hours, people run a flood of animal protein and dairy products and hydrogenated oils and refined sugars and vegetable oils through their bloodstream. And it causes inflammation throughout the body. It initiates plaque formation that sets them up for heart attacks and strokes. It clogs their insulin receptors, setting them up for diabetes. Sets off inflammatory reactions throughout the body. And again, it's this animal-based, overly processed nutrition, quotes around nutrition that people are sending through their body. Fortunately, changing to a whole food plant-based diet reverses these conditions. It would seem intuitively obvious. It was published in the prestigious medical journal called Duh. And when I put my patients on whole food plant-based diets, as we do at our True North Health Center in Santa Rosa, California, we see wonderful things happen. The obesity melts away, the arteries open up, the high blood pressure comes down, the diabetes resolves, the joints stop hurting, the migraine headaches go away, the asthma gets better. And so if there's anything I could tell you, please learn about whole food plant-based nutrition. It's simple: fruit and oatmeal for breakfast, salads and soups, colorful salads, hearty vegetable soups, big plates of steamed green and yellow vegetables, lentil stews, healthy bean burritos on lettuce boats there, and colorful fruits for desserts. And take a walk every day and laugh a lot. And your body will transform itself to a lean, healthy one with normal pressures and numbers, and you won't need the services of people like us. And so whole food plant-based diet has been the key all along. It's the key to rescuing our health system on every level. We could use that money for much better things, and we would be able to enjoy seeing our patients on the bike paths rather than on the operating tables.
Yes, I'll echo some of what Michael said. Can you hear me? I think my mic is up. Okay. In medical school, our teachers were the sick, the dying, and the dead. The first class we took was when we autopsy cadavers, so that started off with the dead. And we mostly focused on, managing disease states. In our upper level classes, it was a matter of just managing this disease. This diabetic came in, this hypertensive came in, the heart failure patient came in, et cetera. And so we focused on managing the disease and treating the disease as opposed to treating the whole frame of the patient. And so when I started my career more than 20 years ago and hung my shingle up after my cardiology and electrophysiology training, I started treating patients in the emergency room. And over time, I saw that despite the advancing technology, the procedures we did, the devices I implanted in them, the medications I gave them, the patients got sicker and sicker. And it wasn't until I discovered the benefits of optimal nutrition, specifically a plant-based nutritional regimen, that I started seeing remarkable changes. It wasn't a matter of just treating heart failure or treating diabetes or treating high blood pressure, et cetera. It was a matter of removing poison from the body. And the standard American diet, the types of foods my patients consumed on a regular basis, was poison. And when I removed the poison and then replaced it with natural food, i.e. plant-based nutrition, then the body healed itself. It didn't matter how sick my patients were. I had patients that had quadruple bypass, stents, the heart was beating at 10%, they had defibrillators in, they were on 21 medications. When I put them on a natural plant-based diet, the condition reversed. I've had patients on life support where I fed them just plant-based food through a PEG tube and was able to wean them off the ventilator and have them walk out of the hospital on 2 occasions. That's how resilient the body is, and that's how well the body will heal itself. So in my book, I have a picture of a tree that has the stump of the tree and then the branches. And the branches have lots of different diagnoses. It has hypertension, diabetes, weebie-jeebies, you name it. In our standard allopathic medicine, we treat the leaves. We'll give a medication for this leaf, we'll give a medication for this leaf, but the source, the trunk of the tree is poor nutrition. And we ignore that. And so from the standpoint of taking care of your own health, or if you're a healthcare professional, taking care of the health of your patients, you want to address illnesses at its core. And the core is poor nutrition. And when you do that, the body will heal itself. Thank you very much.
Okay. Am I on? All right. I think that what happens today when people visit doctors is it is the collision of low expectations. The patient arrives at the doctor's office not knowing that he or she can be healed and resolve these diseases. And 90% of the time, or maybe more, the doctor was not trained to heal these diseases either. So what an unfortunate coincidence. 2 people who have very low expectations about the patient's health get together, and you know what? Those low expectations are met every time, and that's very unfortunate. So I think one of the common denominators of all of us here is we're all trying to change that. And I think one thing that's very helpful and what I want to be really clear about and convey is that I have every confidence that we will be able to change this, and during our lifetimes. Part of the reason being that we eat well, we're going to last a lot longer than the people who don't. That's good news. Some of our detractors are dropping like flies. We're still here. But there's another issue, and I think that we have to really take this to consumers, and they're going to have to drive the conversion, because there aren't enough doctors like the ones you're seeing at this conference and listening to make this revolution happen. And institutions are hard to change. But when you motivate consumers, and consumers are the ones that have the most at stake, and they're going to be the easiest to motivate. I talked about this afternoon, that the consumer is the most affected by the decisions that get made. So I think we can motivate consumers to take charge of the situation in a number of different ways. To first of all, gain control of their own health, and then to start spreading the message to other people. And I think that our medical system is so fragile right now. It's being held together with chewing gum and paper clips, really, that it wouldn't take much to disrupt it in a major way. I mean, 10, 20 million consumers who just say, I'm dropping out. I'm not going to be a sick person in the medical mill. I'm going to be a healthy person who eats well and exercises and stays away from doctors unless there's something really, really wrong with me. The system couldn't afford 10 or 20 million withdrawals. And then you'll start to see the shift, because everything shifts in response to demand. And won't that be an exciting day? And everybody here can be a very active participant in that. So I guess what I would encourage anybody watching this to internalize is that the solution to this whole problem, it's us. It's one person at a time. Every time you impact somebody by leading by example, by showing them a better way, modeling good behavior, every time you just get one more person on board, it's one more person closer to that tipping point, which is where everybody will know about this. And I think once everybody knows about it, our healthcare bill will go from $3 trillion to about $600 billion. We'll really take good care. People say we don't have enough money to take care of everybody. We've got plenty of money to take care of everybody if we just take care of the things that really need being taken care of. And this problem can be solved. And I think it'll happen in the next 10 or 15 years. So I have a very, people say, you know, one person told me, you're so optimistic. And the person standing next to him said, no, she's too stupid to know how bad it is. Honest to God, this happened. And I said, well, I may not be too bright, but I'll take my optimistic outlook any day. So.
Okay, full disclosure, I'm the only person up here on this panel that's not a doctor. But I have recently published a book with a medical doctor, Dr. Carrie Graff in Canandaigua, New York. And the way we met was I actually done some work. I'm on the board of directors of the T. Colin Campbell Center for Nutrition Studies. And a few years back, I had asked Colin Campbell his definition of the optimal diet. And I think he had put it in his books, and he said, the closer we come to eating a diet of whole plant-based foods, the better off we will be. So as kind of being an outsider in this field, I said, you know, we need a better terminology for describing the optimal diet than vegan or vegetarian, neither of which describe necessarily an optimal diet, because both of them focus more on what we're not eating than what we are eating. So I came up with a little scale. I called it the 4-leaf scale, and I sat at Colin's breakfast table and shared it with him. And he said, and the deal was, we're going to have it 1-leaf, 2-leaf, 3-leaf, 4-leaf. At 4-leaf level, you're getting at least 80% of your calories from whole plant-based foods. And at 3-leaf, it's over 60% of your calories. And it's not necessarily vegan or vegetarian, but it's focusing on maximizing the healthiest of foods, according to T. Colin Campbell. And I think a definition that most of the doctors that I know, probably the ones at this table, agree with, the closer we come to eating a diet of whole plant-based foods. So I created a survey called the 4-Leaf Survey, and that's how Dr. Carrie Graff found me. And we got together and started talking about how she had seen Forks Over Knives and was really excited about changing her practice and was looking for tools. And so she contacted me and we got together. And that's the origin of how I happened to write a book with a medical doctor. People are asking me, are you going to write another book? And I said, no, I don't have anything else to say. But after I met Carrie and saw what she was doing with her practice, a family medicine practice in upstate New York, and she was just so thrilled to be able to help her patients reverse their diabetes and heart disease and hypertension and you name it. So after being around in this field now for like 12 years and meeting most of the players that are the best known people, the medical doctors and the scientists. There aren't many scientists, by the way. T. Colin Campbell's about the only one. But I am very, very confident that for this to really gain traction, we have to get more medical doctors on board. People trust their health with their doctor. And right now, if you were to watch Forks Over Knives and get excited about this diet of whole plant-based foods, if you went to your doctor, the chances are 10 to 1. If you told him or her what you're going to do, chances are 10 to 1 that you would hear more words of caution than you would encouragement, because the word is simply not out there. Now, I don't know what the answer is to get the masses on board in the medical profession, but I have one thought. Kaiser Permanente has, according to my research, 28,000 medical doctors. There's 2 different divisions. One's headed up by Robert Pearl and the other one's headed up by Bernard Tyson. And there's a group of medical doctors within Kaiser Permanente. I think they said it's about 200 doctors that are all gung-ho about plant-based nutrition, and they're really working with their patients. And when I talk to those guys, and I've talked to a half a dozen of them, I say, what about the CEOs? What about Pearl and Tyson? Why are they not requiring that the other 28,000 doctors start doing this? Why are we letting heart disease and cancer and type 2 diabetes kill people for no reason? And until we get a lot of doctors on board, we're just not going to get there. So for whatever I can offer to this panel tonight, I'd be happy to do so, but I am the only non-doctor on the panel. Proud to be here.
If you have 2 people that come to you and they both have the exact same sleep, emotional health, they exercise, they eat vegetables, they take wheatgrass, they do green juices, they're perfectly same diet, everything is good, but the only difference is one of them at lunch and dinner eats a whole food plant-based diet. Their protein is chickpeas or quinoa or lentils, and the other person who has the exact same diet, just at lunch they have 6 ounces of chicken, and at dinner they have 8 ounces of fish, and they do this every night. What is the difference that you've seen that happens, because both of them would say they're eating a very healthy diet? What's the difference? What's going to be different about the 2 different people's health over a long period of time? What's your experience been?
It's night and day. I have a saying to our patients and clients who follow our program, and it's not a bite, not a drop, not a crumb. And what I mean by that is that when you consume a natural plant-based diet, especially and we deal with patients who have advanced diseases. And so once they get to us, there's very little room for error. So when I have a patient come in and they follow the program and they do very well, and then they have 1 bite of fish, we'll see the blood pressure shoot up. They'll go into decompensated heart failure. I've seen patients go into decompensated heart failure and end up in the ICU over just a bowl of soup, chicken soup or something like that when they're detoxing. So we have a long experience of patients with severe illness who we turn around with a plant-based diet, and when they just have a small amount of animal protein, it makes a big difference. So with that example you gave, you can see a very big difference between the two individuals who come in. And oftentimes we see patients coming in who are relatively healthy, they're exercising, and they just eat a little bit of fish every now and then, not even every day. You gave an example of every day. I'll take your example. I said, well, just once or twice a month. And we see a big difference. The cholesterol level is very high. And we remove just a small amount of fish once or twice a month, and the numbers come down. So it's like night and day. And the analogy I give is that, well, I give several analogies, but if you just put a little bit of cyanide in your coffee every morning, okay, how far would you have to run it off? There's no, and cyanide is low in calories and low in carbs, by the way. And so the point is that it's poison, and we all understand that doesn't make sense. It's poison. And we have to understand a little bit of chicken and a little bit of fish, the biochemistry of these foods. It's not the calories. I know there's fat in them and all those other things, but it's the biochemistry of these foods that's abnormal for our system. And so that's why a small amount is too much, because it's like putting a small amount of cyanide in your coffee every morning. It may not kill you right then and there, but it's enough to make you sick because it's the abnormal biochemistry of these substances.
One thing I'll add, you forgot cyanide's also gluten-free. It's also very important. I deal with some pretty critically ill people too, but then I deal with people who are less ill. But I think one of the big changes that I've seen in the 20 years that I've been in this business is 20 years ago, we saw a lot of people who were eating terrible diets. I mean, terrible, 3-5 meals a day of awfulness, right? And what's changed is that we still see some of that, but we also see people who say, they'll sit in my office and they'll say, I don't understand how this happened to me, whatever this is, lupus or breast cancer, because I don't drink soft drinks. I haven't had fast food in 15 years. And, you know, I'm not a dessert person, and we don't keep potato chips in the house, and they'll go on and on and on about all the things that they're not doing. And so they're flabbergasted because they really think they're eating a healthy diet, but they're still eating a terrible diet. It's better, and the analogy I use is it's like saying I am financially so much better off than people on welfare, okay? Because, well, that's not a good benchmark if you're trying to become financially successful. So saying my diet is so much better than everybody that I know. Well, if you take a look at the diets of everybody you know, being better than that isn't really saying very much, right? So, which goes to your question, eating chicken and fish is supposed to be healthier than pork chops and beef. Small portions, everything in moderation, right? That's supposed to be good. I eat a lot of fruits and vegetables. People will go out of their way to tell me that. We always have a big bowl of fruit on the table, and that's all well and good. But you're still doing enough wrong things that you're not going to have excellent health. And the big analogy that I use to explain this, you know, how many things can you get away with, is that I think that diet is like a combination lock. Okay, so feature this. You've got a safe in the wall. There's $10,000 inside of it. There's a combination lock on the front. It takes 4 numbers to open it up. So you dial up 3, and here's the deal. You don't get $7,500. You have to get the 4th number right. And a lot of the people I think that are visiting my office and the offices of my colleagues, they've got 3 out of 4 numbers right, but until they get that 4th number right, they're going to have lupus, they're going to have breast cancer, they're going to develop type 2 diabetes, and they're going to gain weight and all the other things that we see.
People who follow that philosophy, and I think what Dr. Popper and blanked on my friend and colleague's name here, Baxter, who just said, is so appropriate. The people who say, well, I just have a little chicken or a little fish, etc., so grossly underestimate the complexity of the human body. Like in any natural system, you can't do one thing. Everything that you take in sets off cascades of reactions throughout the body, and that bit of animal flesh, whether it's from a fish or a cow or a chicken or a turkey, sets off dozens of reactions. You're going to spawn different bacteria down in your gut, which are then going to do different things to the foods that come down to it subsequently. You're going to induce different liver enzymes in your liver that are going to detoxify the proteins, et cetera, coming up from the body, from the intestine in a different way. Everything is going to be different. And since we are not carnivorous apes, no matter what the paleo folks try and sell us, our systems dysfunction on dozens of different levels, and arteries have a subtle level of spasm, they lose their elasticity, and inflammation sets up in the artery walls. And the gut begins to dysfunction in various ways as far as the motility. Pick an organ, you're going to change the physiology of it. Plus, these are modern day 21st century chickens and fish. They are fed growth promoters and grains to make them put on as much fat as possible. And the pesticides and herbicides and antibiotics these birds are fed are fat soluble. And so every bite of that drumstick or that chicken breast, all these fat soluble toxins are coming in, and they in turn cause pathology to happen in the body. So even, oh, I just eat a little chicken. Well, how little? Doesn't a little 1 week old? You know, how little? People say little fish. You know, guppies? You know, how little? You know, the fish there. But the fish are contaminated with mercury and pesticides, and the farm-raised fish have antibiotics and growth promoters, etc. These are unhealthy animals to begin with, and by their very nature of what they really contain, sets off imbalances throughout the body. Those two individuals, the one eating the flesh and the one eating the plants exclusively, are two totally different metabolic creatures, and the one who are continually disrupting their natural healthy equilibrium with the animal foods are going to be seen in their doctor's office a lot more frequently.
The obvious question that anyone who's not a follower of your work is, I don't know, I hear a lot of people are on this paleo diet, and there's lots of books on Amazon that are bestsellers about paleo, and everyone's talking about it. And I don't know, there was an article in the New York Times today about it that said that maybe it's good for diabetes, and paleo sounds pretty good. So from your experience, what's wrong with paleo? What are you seeing happen when people go on these Atkins, paleo, low-carb diets that you're not seeing when people go on a whole food plant-based diet?
Well, my experience is that they're coming in, they've already tried these diets and they still have their diabetes, so it's not too much. Many of them have been on the paleo diets and Atkins, they've tried many different things. And so when they hear about us, that concept has already been proven wrong. So that's mostly our experience. Now, yeah, I do get some kickback from individuals outside the clinical practice. And essentially what I just do is share our data. I mean, we see patients, and we have data within 4 weeks of them coming to see us. Inflammation goes away. The blood pressure is better controlled. The blood sugars are better controlled. We're reducing medications. We reduce medications. Our oldest patient, 102 years old, she came in on 7 medications with heart failure, and we got her down to 1 medication within a matter of weeks. The patient's in her 90s, and one in her 90s, she's been on insulin for over 40 years, and within 2 days of being on our program, she got off insulin. And so I tell people, you show me this data on paleo diet. Show me someone on a ventilator coming off on paleo diet. Show me this type of data on paleo diet. It doesn't stack up.
I agree, and one of the things that's very deceptive about paleo diets and Atkins diets and drugs, for that matter, is that there are a lot of things, strategies that you can use to change biomarkers quickly. And people, and diet also, but in terms of what people think are the ways to change biomarkers quickly, their neighbor does a paleo diet and his blood glucose drops and he says lose 20 pounds and the whole 9 yards. He says it's great. Somebody else does Atkins, somebody else is taking a statin drug. The problem is we're so myopic sometimes in looking at short-term drops and surrogate markers, essentially. We're measuring surrogate markers instead of disease outcomes. So, and in cancer, we do it all the time, by the way. This chemotherapy drug shrinks tumors in 30 days. Everybody's dead next year, but by gosh, you got a great 30-day thing going on. And instead, we should be focused on what happens to this person if he or she eats this diet or takes this treatment. What happens 10 years, 20 years, 30 years out? And all this stuff falls apart when you get beyond that initial change. And part of it is because, particularly with the paleo diet, they're not wrong about everything. They say get rid of the dairy, eat a lot of vegetables, okay? You don't want to eat all that processed and refined junk. So of course you're going to see some health improvement, even if they are eating elk and moose and whatever else is on that diet. I mean, it depends on who you ask, but you're going to see some improvement. But 10 years out, 20 years out, you're going to see a lot of cancer. You're going to see a lot of heart disease if they don't already have it. So you're trading one problem for another down the road. So I think it's a short-term myopic view that as long as my blood glucose levels are lower tomorrow, as long as my cholesterol drops, it doesn't matter how I get there, it's just that the numbers changed. And actually, as it turns out, it really, really matters how you get there.
My two colleagues said the major points that I was. The paleo myth is just that. Like every caveman had a mastodon in the freezer and spent all day eating mammoth meat because they're cavemen, that's what cavemen do. But it's not based in reality. When they study the coprolites, the fossilized feces of the Pleistocene folks and the Paleolithic folks, they're filled with fiber. They spent all day foraging and pulling up roots and tubers and harvesting nuts and berries and leaves and edible grasses. And they were largely starchivores. And most hunts were unsuccessful. Carcasses rotted quickly. What got us through were plant-based foods, and there's no real question about that. And from a strictly medical point of view, if someone asked me, Doc, I want to cause a colon cancer, how do I do that? Well, pack your colon full of meat 3 times a day and let that rub on your colon wall for 30 years. You watch what you set off there. These are my friends and patients and colleagues who have fallen prey to this myth, but I fear that they're setting themselves up for an epidemic of clogged arteries, colon cancer, strokes, heart attacks, autoimmune disease, colitis, and Crohn's disease. This is not a healthy human diet. We evolved for the 2 million years before the Paleolithic era eating plants. That's what all simians, all of the great apes eat today. They said, so they mostly eating foliage, and meat is a rarity in most of their diets, and in gorillas it's not even in existence at all. And it's a fantasy. It sells a lot of books. Like my colleague Dr. McDougall says, people love to hear good news about bad habits. Yeah, paleo diet went on, it lowered the cholesterol. Yeah, you may get some temporary improvements, as was mentioned, but over the long term, this is a diet of death, and it kills the people who eat it. It kills the animals. It's going to kill this planet, and you can start a pool for when the articles are, well, they're already coming out. Paleo diets associated with higher rates of heart disease. Paleo diets increase all-cause mortality, meat-based diets. They're already starting to show up. You can make book on it, and then they'll say the big oops, gee, we didn't realize that this happens, this happens, this happens. So I urge people not to fall for this mythology. It will lead you to a early demise.
While I was listening to Dr. Klaper, I have a friend, his name is Don Matez. He lives in Phoenix, Arizona, and he wrote a book called Powered by Plants. He used to be a paleo eater. Interesting story. And he lived in Ohio. We were working on legislation together, and we just agreed to disagree because he was eating a paleo diet. So he ended up getting divorced, and he ended up teaching. He was head of nutrition studies for one of the naturopathic colleges in Arizona, still eating a paleo diet. He got remarried, and his wife adopted a paleo diet with him, and she put on 20 pounds, and her health started going downhill, and his health started going downhill at the same time. So this is a former paleo eater turned vegan eater who writes this book called Powered by Plants, and he set out to refute the paleo diet, and he does a great job of doing it. There are 900 references in this book. It's really a great book. But one of the most important lines in the book is in the beginning when he's talking about why do we all focus on this paleo diet. He said people sit around and try to figure out what people were eating 6 million years ago. We have such great data on what people have been eating for the last 200 years and the health results that have come about as the result of it. Why are we fantasizing and talking hypothetically about what people ate 6 million years ago? We've got present day data that tells the whole story. And I thought, what a great way to just kind of get out from under that discussion. So I'm not an anthropologist or an archaeologist, and I can't really even engage in the discussion, but that's a way for me to get out of the discussion. Let's talk about what we do know. And what we do know, paleo stuff does not work in the long term.
I've got one comment to make about this. There were, about 2 or 3 years ago, Dr. T. Colin Campbell had a formal debate with Dr. Eric Westman of Duke University the head MD in charge of lifestyle medicine there. It was at the University of Alabama, Birmingham. It was a mainstream crowd. And Colin Campbell was arguing for the whole food plant-based diet. Dr. Westman was arguing for the paleo diet and all the low-carb diets, the Atkins diet. He had just been a co-author of a new book, The New Atkins for a New You, or something like that. Some of you probably heard of him, Eric Westman.
Yeah.
Well, if you'd asked the audience after the debate who won the debate, they would say Dr. Westman. Well, he was polished. He had more studies than Dr. Campbell had, and people like to hear good news about their bad habits. And so I came away from that thinking, this is just absolutely ludicrous, and so I wrote a few blogs about it, and I said, you know, what if the paleo diet was the absolute healthiest way for us to eat? Well, we're going to have to choose a team here because we got 7 billion people on the planet, and we can only support 3 billion people eating a paleo diet. So, which 4 billion do want to head for the door and go and die? Because that's just the fact of the matter. And you compare that also, add to it the evidence that these 3 doctors and every plant-based doctor that I know about talk about how many paleo diets have reversed any diseases, how many, you know, it's just about short-term weight loss and muscles that look better or something. I don't know what it is, but it is totally unsustainable.
And I have another comment. You know, and we often get confused with different diets and science and that type of thing. And often what I tell my patients is just use let's go to simple deduction. Let's take the paleo diet, let's take the Mediterranean diet, let's take a plant-based diet, etc. In all those diets, why don't we just remove the plant-based food from all of those diets? Paleo diet, you're left with, I don't know, moose and whatever, chicken. You know, the vegetarian diet, you're left with cheese and eggs. The Mediterranean diet, you're left with fish, maybe some chicken. Vegan diet, you're left with nothing. So if you remove the plants from all of those diets, how healthy are those diets? How healthy is the paleo diet? How healthy is your diet if you only ate fish? How healthy is your diet if you only ate chicken or only ate turkey? We inherently know that just only eating these foods is not healthy. And so if you then add plants back to those diets, the common denominator of the healthiness of any diet is going to be the plant-based foods. And so if you go to a whole foods plant-based diet, which is only plant foods, it has only the foods, the nutrients that are essential. Everything else is non-essential. And so that's the simple deduction. The paleo diet would not be healthy if it were not for the vegan part of it. The Mediterranean diet would not be healthy if it wasn't for the plant-based component of it. And so it's really a simple deduction that the healthy component of any diet is plant-based foods, and that's really the foods you need to eat. As simple as that.
If someone is already 80 years old and they go, what's the point? What's the benefit? I'm already 80. What's the difference? And on the reverse side, if someone goes, I'm 20, when I'll eat whatever I want, and then when I'm 40, I'll start cleaning up my diet because people don't really have heart attacks in their 20s and 30s. So for someone who's very young or very old and saying, what's the difference? Is there any significant benefit that you could think of for why they should change?
Yes. Well, you know, I'm going to share a story with you. It happened to an employee in our office. And her mother was 88. And so let's take an extreme case here. 88 years old with terminal cancer. And fortunately had a doctor who said, we don't really have a cure for this. And so I think the most important thing for you to do is to enjoy the rest of your life, not to spend it in and out of hospitals getting treatment. And she'd never eaten well, this woman, but my then employee decided that she would take some time off of work and make sure that her mother ate well for the remaining time she had to live. So she'd ask the doctor, how long do you think I have? He says, it's pretty aggressive. I'd say really realistically 90 to 120 days. Okay. That's a terrible prognosis. So her daughter takes the time, starts feeding her optimally, not a single bite of food going into her body that isn't optimal. And she did indeed die. 18 months later, not 3 months later. Stayed at home the whole time. And we were in contact, her daughter and I, over this period of time. And for 17 out of the 18 months, living in her house, playing cards with her girlfriends, took a couple trips, you know. And then the last month or so, it just went straight downhill. And the point of telling you this story is that even when you have a terminal diagnosis, you're better off doing this. Because wouldn't you say 18 months is better than 3, 17 months of very high quality living is better than none, even if the outcome doesn't actually change in the end. So working backwards from there, I think that people underestimate, you know, Dr. Montgomery was talking about, you know, the 102-year-old woman coming off, people underestimate how strong and incredibly powerful their bodies are, even at older ages. And for younger people, the first thing is, younger people are getting diseases. I mean, I don't know about you guys, I see a lot of people in my office, 25 years old with breast cancer, Crohn's disease. I have one who was born with Crohn's disease, born with it, taken to the hospital with a bloody diaper at 7 days old. So I think it's a myth that these diseases are occurring in mostly older people now. I think the age is ratcheting down as the bad diet starts earlier and earlier. And so I think what you say to a younger person is, first of all, we may appeal to that person more with what you talk about, which is environmental concerns, animal welfare, because they do think they're kind of impervious. But the second thing is you're playing Russian roulette with your health when you eat this way.
I had a professor in medical school who said, people don't get diseases, they earn them. And meal by meal, cigarette by cigarette, drink by drink, argument by argument, we earn our diseases. And it starts in childhood. And that person who's 20 years old has huge control over what's going to befall them during their life. That needs to be made clear to them. And as Dr. Popper said, we're now seeing clogged arteries and high blood pressure in people in their teens, in their 20s, and their 30s. These diseases start early. And as already said, on the end of life, the body has such amazing resilience and healing power within it. If you just give it the fuel that it is looking for, age becomes semi-irrelevant, as you just heard that story. The version that I get frequently from my patients, well, doc, you gotta die some. I'll eat my cheeseburgers and pizzas, I get my heart attack and die. You know, you gotta die some. I've been a physician 45 years. I have seen that scenario sometimes plays out, but Mother Nature has other tricks up her sleeves. And what happens is that you get your stroke and you don't die. And you spend your next 30 years in a wheelchair drooling with some pretty nurse wiping your backside because you can't reach back there. That does wonderful things for a marriage. That does wonderful things for one's self-esteem. Or to get a heart attack, as Dr. Baxter knows well, and lose half your heart muscle. So you get out of breath walking to the mailbox. The world gets pretty small when you're a cardiac cripple on that level. And so, again, people don't appreciate the complexity of the human body and what nature can have in store for them. And I try and make that clear to my patients. This is no laughing matter. This is no game, and you do not want to play medical roulette with your future. And every meal matters. And I show them what happens to their blood when they eat a cheeseburger, how fatty their blood becomes for hours and hours. And during this time, their arteries are getting inflamed and clogged up, and fat is layering out on their abdomen, and hormones are being changed that set them up for breast cancer and prostate cancer. Again, you can't do one thing. And information is powerful, knowledge is powerful, and once they see that blood turns milky white after a cheeseburger, in many, everybody has a wave of fat that goes through their bloodstream. this can make a big impression. So people love to justify their bad habits with a flip remark, etc. But some honest teaching goes a long way, and that's why the media and meetings like this and the internet have such a huge role to play. We don't need another study showing that plant-based diets lower high blood pressure. We know that. It's a matter of education now, getting it out into the populace so plant-based nutrition becomes, of course, that's what you eat if you want to be healthy. And young people in the internet have magic when you put them together, and you can spread good ideas with a couple of mouse clicks around the world. So I'm optimistic, but there's no time for complacency, and people hide under these little rocks of ignorance and sarcasm. But you need to uncover those rocks and let the sun shine in.
If someone is eating only organic eggs and organic dairy products and free-range beef and organic chicken, does that help the situation health-wise?
More marketing ploys to make people feel good about doing things that are harmful. And cow's milk is baby calf growth fluid, whether that cow, the mother cow, was fed grain sprayed with pesticides or not. That milk coming out is filled with growth factors and estrogens and leukemia viruses and inflammatory blood cells and all the things inherent in cow's milk, whether or not the cow is fed organic grains. Or beef is going to be, by its very nature, animal muscle raises the levels of insulin-like growth factor 1, IGF-1, skyrockets after beef, and so does insulin levels. And these are some of the most powerful growth-promoting, disease-promoting molecules known to biology. If you have a little cancer in your prostate or your breast, this is like throwing gasoline on a fire, and it's just the nature of the substance you're eating. The same thing with eggs. They're going to spawn bacteria in your gut that will turn the choline in the eggs into trimethylamine oxide that damage your artery walls and drives cholesterol into your artery walls. This, just by their very nature, organic or not, these are harmful substances that cause grave imbalances throughout the body. But people love to hide behind or soothe themselves with these marketing ploys. Oh, it's organic, oh, free range, grass-fed. The nature of the substance itself is harmful. We are not carnivorous apes, and when we try to eat that kind of diet, we spawn diseases of all kinds in every organ system of our body. So take no comfort whether it's grass-fed or not. And in fact, as you'll hear from Dr. Richard Oppenlander, the grass-fed beef is, for the environment, is the worst of all, because those animals live 2 years longer. They have 2 years longer to pour methane and carbon dioxide into the environment. We have used up animal flesh as a food. No matter what it was throughout history, there's 9 billion of us on this planet. We have used up flesh eating for all the reasons, health-wise, environmental, etc. It's time for this whole planet to shift to a plant-based diet. So holding on to the organic label or the free-range label is rearranging the deck chairs on the Titanic. We've got to move past animal flesh consumption on every level for every reason you can think of.
One thing I'll add is one common denominator, no matter what diet is being promoted, is the promoter of the diet thinks that it would be best if everybody ate that particular diet. So the paleo people say everybody should eat a paleo diet, and the Mediterranean dieters, they want everybody to eat a Mediterranean diet. Well, if we look at it from the standpoint of organic eggs and organic animal, beef and chicken and organic milk and organic cheese, the common denominator of that diet, regardless of which selection of animal foods, is it's completely unaffordable by 95% of the people who live on this planet. It's a diet that is economically unavailable to people. And so and contrast that with a plant-based diet. We have taught people using SNAP money and WIC money how to eat this diet. I teach a a course through our school that teaches practitioners, dietitians, nurses, physicians, how to tailor diets to people's specific disease conditions. So you've got somebody who has Parkinson's disease and can't hold a knife, for example. There are specific things you have to do for that person, et cetera. Well, one of the assignments I give the class every time I teach this particular course is to design a meal plan for a family of 4 who are restricted to eating with SNAP money. No other money allowed. You have to make the diet plan for a week using these resources. If you saw these meal plans, it's what I eat at home. I mean, these people are not going to be eating out in restaurants, and they're not going to be having meal delivery to their house. But I'm talking about if you go to the grocery store and you buy the food and you can season it well and the whole 9 yards, a family of 4 can eat like all of us with SNAP money. Now, isn't that a better thing to make available to people, even if the diets were equally health promoting, which, as Dr. Klaper said, they're not, but even if they were, our version of the diet is economically accessible to almost everybody on the planet, and that's a consideration we cannot ignore.
I have something to add to, I think the question was about free range versus, I guess, CAFO food. Whether an animal is free range or raised in a factory farm or whatever, they still produce excrement. This is my part of the program here. Earlier today, I had some factoids. In just the United States alone, the manure that is produced by our food animals is 113,000 pounds per second, 24/7, 1.78 billion tons a year. And this is not counting fish now, this is just the land animals. And so if you're a meat and dairy eater, you are a big part of that process, and your share of that 1.78 billion tons a year is 12,000 pounds. If you're a family of 4, your share is 48,000 pounds. And if your share arrived at your doorstep on Christmas Eve, it would take 48 half-ton pickup trucks to deliver your share of the excrement that you caused to be produced in just this country. Now, is that sustainable? Is that what we really want to do? Free range or feedlot, it is just not something we should be doing, particularly in light of the fact that it causes bad health for everybody that eats it.
Just so I'm clear, for someone, whether it's free range or not, what specifically is wrong with eggs and what's wrong with fish? A lot of people say, I don't eat beef, I don't eat a chicken, I just have fish, or I just have some eggs. So with just eggs and fish, what's wrong with those 2 foods?
Well, these have molecules that the body will see, and it triggers inflammation in the body. So the immune system will see certain molecules on the egg, certain molecules on the fish, because these are from animals that are inherently foreign. I mean, a cow, a chicken, fish, these are animals that are non-human. So let's say, for instance, I give an example for my patients. If you needed a kidney transplant and you needed a kidney, you're waiting, I said, I have a cow in the backyard. Why don't I get the kidney from the cow and, we can transplant it in you? And they say, well, no, that doesn't make sense. And so why not? So the body would reject it. Well, how does the body know to reject the cow's kidney? Well, it knows to reject the cow's kidney because it recognizes foreign. Everyone has an immune system that recognizes something that's foreign. And so the protein on the cow, the protein on the chicken, the protein in the fish have molecules that are uniquely different than human proteins. And your immune system recognizes these substances. Well, it doesn't matter whether I implant the kidney in the vascular system or consume the kidney by mouth and it gets into my vascular system through my gut. The foreign aspects of the chicken, the fish, the cow, whether it's organic or farm raised or wild caught, it's still a foreign animal substance. And your body's immune system is revved up every time it's exposed to these foreign molecules.
Protein is an obsession in this country, and Dr. Garth Davis, we're still waiting for him to appear, wrote a book, Proteinholic, and it's becoming very clear that protein is toxic to the kidneys and to many other organs. It spawns bacteria in the gut that in turn put toxic products into the body. And to the end, we're living in the time when we have treated our oceans like sewers, and the fish flesh today is redolent with mercury and pesticides and the waste of modern society that we're pouring in, and these animals bioconcentrate these toxins by eating the smaller fish. And I think it's foolhardy to be eating the flesh of any fish from the oceans these days, unless you are looking for your minimum daily requirement of mercury and pesticides. Plus, we can't pretend these fish come from nowhere. We are pulling 2 trillion living animals out of the ocean every year. There is nothing sustainable about any of these fisheries. We see every one of them being decimated. And we're going to leave our children an ocean full of jellyfish. And it's time to leave the fish off the hook at this point. We can't pretend that there is no ecological price to be paying for, oh, I eat fish. Those fish have a purpose beyond our dinner plate. And similar with the eggs, I invite everyone to go to the superb website of Dr. Michael Greger, nutritionfacts.org, and his health topics, hit E for eggs, and watch his videos on what egg yolks do to the artery walls, what they do to cholesterol levels, and how those are all obfuscated by the egg industry that plays all sorts of games with the statistics in their advertising. But there's no way that the substances in egg are going to do beneficial things for the human body when consumed, certainly on a regular basis. And the fish, we've used that up at this point. No matter what was the role of fish throughout history, it's time to let these oceans heal. We are clear-cutting them. We are strip-mining the oceans, and enough already. And the farm-raised fish are ecological horrors in themselves. The amount of antibiotics that are fed those animals, and the dead zones that spread out of these fish farms from all the excrement that those fish produce. Enough already. It is not a health food, despite its reputation. It's moving exactly in the opposite direction. But for all the reasons, if you care about this planet, it's time to declare a truce and stop commercial fishing and stop eating those poor animals.
If someone comes to you and says, I've heard everything you said, I've read your book, I think it's great, I'm not changing a single thing, I'm keeping everything exactly the same, I'm a 55-year-old man, and I'm not making any changes, but should I take a statin drug? So if the obvious answer is you want to say, don't take the drug, eat a whole food plant-based diet. But if they say, I'm not doing it at this point in my life, I'm not changing to a whole food plant-based diet, should they take a statin drug if they have, let's say, somewhat high cholesterol?
The first thing I say to them is thank you very much. I've got 4 kids that put through college, and the standard American diet contributes to high blood pressure, diabetes, heart attack, and stroke. And you're going to have to be in my office going through these procedures and generating income. And so I say thank you very much for the contribution of my kids' college fund. And so. But the other thing I say, if they're not willing to make those changes and their cholesterol is high, the standard of care is to take a statin drug. And so, yes, I'll give them a statin drug. Now, they're consuming the first poison that they refuse to discontinue taking the first poison, so then I have to give them the second poison to treat the side effects of the first poison. Now, I'm only correcting a biomarker, and by and large. And so the statin drug will lead to other side effects that can have neurological side effects and muscle side effects. There, diabetes or insulin resistance. So there are other problems that are going to contribute to that. They're going to have to come back to the office to get more tests. So if their blood sugar's out of whack, then now, okay, great. You have diabetes now, we have to treat that. And oh, by the way, now we have to do Doppler studies on your legs. So that costs more money, and it goes to my kids' college fund. And we have to get a stress test, a nuclear stress test every year. And oh, if you have any chest discomfort, you might need a heart cath. And you have chest discomfort, you give ECP therapy. So if they continue to consume this bad food, they go down that cascade of the, sick care therapies, and that's the standard of care. And I'm obligated to provide that for them.
I think that, yes, you give the person a statin drug, but as I said in my talk this afternoon, my argument is that if you're not seeing doctors like these doctors here, which we need a whole army of doctors like Dr. Klaper and Dr. Montgomery, what happens is the statin drug is prescribed without any discussion like what you just heard. And so what I think should happen, this would be a great change in medicine, is consent forms. I understand that this statin drug that I'm taking is going to reduce my risk of a major event by 0.7%. I have read the 23 pages of side effects, and I have been thoroughly explained the benefits of eating a plant-based diet, and I consent to take the second poison because I refuse to give up the first poison and sign it and date it and notarize it. And I think if we did that, we'd cool down a lot of enthusiasm for these drugs. It's the main reason why people say, your hypothetical 55-year-old person, I understand what you're saying, but I'm not going to do it, I'm going to take a statin drug, is because they are still maintaining the thought in their head that the drug has more of a positive effect than it's possibly capable of producing. And that's what we're working against, is to undo the brainwashing that this stuff works. And let's face it, if you guys watch the commercials on TV for drugs, they make it look like it's fun to have diabetes. You almost want to become diabetic so you can join the party, right? I mean, seriously, we're on roller coasters, we're having a great time, I'm down with Crestor, it just makes it, right?
Yeah.
Okay, so that's it's fun to be sick, the drugs are magical solutions, they conveniently ignore the man who talks 25 miles a second to give the last, squeeze in 100 side effects. But if most people really understood what we're talking about here, they would not choose that option.
And don't forget the kidney failure, you dial a spa.
More college money.
Yeah.
Do you believe the clinical trials are accurate? So in other words, we've talked about that there are side effects for medicine. So people say, okay, I have to take into account the side effects, but at least I get the benefits because the drug supposedly has this benefit. Now, there was a book by a guy named Ben Goldacre who wrote a book called Bad Pharma, Pharma. And for the 15 hours of audio tape that I listened to in the car, he spent 15 hours explaining every possible way to manipulate a clinical trial. And at the end, I was thinking, how do you actually know when you're told that this has this benefit, that you really get the benefit and it's just not a bias by the people who conducted the study? So in terms of when we go to buy sugar cereals, we say, it doesn't matter which one you give me, they're all processed white flour cereals with sugar. But when it comes to medicine, people pretty much think this is tested, it's safe, it works very well, and there are some small side effects. What's your opinion of how we should view prescription medicines and clinical trials?
Well, we participate, in my office, we participated in clinical trials. In fact, we were the lead site for the heart failure drug Entresto. The one that singing that song, tomorrow, the sun will come up tomorrow. So that's exactly fun to be sick. So that's for Entresto. So we were we enrolled the first patient worldwide, et cetera, and so the drug came out with a positive effect, published in the New England Journal, got it to market, record time, et cetera. Largest heart failure study in history. So it was compared to an ACE inhibitor, an older ACE inhibitor, which is part of the standard of care for heart failure. And so patients were given either Entresto or heart failure or Valsartan or Vasotex, and watched over a period of time. And so what they saw was that the patient on the study drug did just a little bit better than the patient on the old ACE inhibitor. But then if you look at all the patients and then you look at the survival curves, they were all dying almost the same rate. It's just that early on, the new drug decrease the death rate by a certain amount, and then after that period of time, the death rate was parallel. And so it was just a relatively small difference, but it's, oh yeah, 27% improvement in survival and improvement in terms of well-being. But every patient got worse, everybody's heart failure progressed, and the new drug slowed it down just a small amount compared to the old drug. And so it's almost as though if you're driving your car and your brakes are completely out, and then they do something, maybe your brakes are only half functional and you get just a little bit better, but your brakes are still dysfunctional. That's the way it is with the medications. And so we can show a little bit of difference over time, but the disease state is progressing. And in those situations where I've seen medications reverse a disease. And so basically it can suppress symptoms or mask the disease, is which we're pretty much doing. But it does it at the cost of many side effects and adverse reactions. And so they've gotten to where they don't even manipulate the trials now. They just do poor studies and they just use it. There's a new drug for, you may have heard, the injectable drugs for cholesterol now. And I sat on one of the panels, one of the faculty panels for that. And it's a monoclonal antibody drug. It inhibits an enzyme that we don't know whose purpose it is in the human body. They've only done safety trials up to 12 months. They didn't see many side effects, but they've only looked at, say, maybe 1,000 patients, subjects in one study, a few hundred in another study. So you don't have a large, population representation. And so it's not until long after the drug has been out on the market you start to see these problems. Now, we see lots of problems with statin drugs that were not reported a long time ago because all the statin drugs are generic now. And all of a sudden you're hearing reports of muscle rupture and mental decline. And of course, in a large study by AstraZeneca, they saw an increased rate of diabetes with statin drugs. And so we're seeing many, many adverse reactions to statin drugs that have been there all along, but they're suppressed. And so the studies, they look at, single biomarkers or clinical events. They focus on those things. Oftentimes they don't look at these drugs long enough to get, a good longitudinal picture of things. And many adverse events go unreported in that short period of time or overlooked.
Another thing to consider is that in the clinical trials, they recruit perfect patients. We get the person who just has high cholesterol. Well, that's not real life. It's the diabetic who also has migraine headaches and 3 other things going on, who now is taking a statin drug. And there is no way to do a clinical trial to test all the potential interactions with all the combinations of drugs that people can take. So you get a whole different picture during, when these drugs are prescribed to the general public as opposed to the perfect patients who are recruited to the trial. And there is a lot of misbehavior going on too. I mean, people have written books about this, that changing the endpoints, there are all kinds of ways that you can manipulate the data so that you produce the information that you want. And just so you know, I've written a lot of articles about this lately. I don't know if anybody here knows the approval rate for new drugs or new uses for old drugs at FDA. It's 94%. 94%. For devices, it's 99%. And I see a time coming when the drug companies will send a memo to the FDA saying, this is just to notify you, we're going to be putting a new drug on the market, and we're probably going to kill a few people, you know how it goes, but we just wanted to give you a heads up that you'll be hearing about this. I mean, at some point, why even go through an approval process? So anyway, I think that the fact that a clinical trial shows a drug to be safe or that it's approved by the FDA doesn't really tell you much at this point.
Very big change for the public to accept, because right now we believe that we're responsible if we go in the candy aisle or the soda aisle to be careful, because we don't necessarily trust that the soda companies are providing us healthy products. But it does seem that most Americans do believe that when a doctor prescribes them a medicine, that this has been is proven to be, 1, safe, and 2, effective.
That's true in general, but I'm seeing now more and more patients are coming back. I'll prescribe a medication, I'll come back, so I decided not to take this drug because I looked up the side effects. I mean, patients are becoming wiser now. And information is at everyone's fingertips now. And so I'm beginning to see a transition, even my older patients. So I looked this up on the internet, and it has side effect X, Y, and Z. And then I'll say, well, did you look up the side effects of that baked chicken you're eating and the fish? And so I'm actually planning on work with my nutritionist and maybe come up with the labels of side effects of dead animal flesh and say, here are the side effects. We're going to put together like a little black box warning of some type of these bad foods. But more people, I'm starting to see a trend in my practice at least, of more people looking up drugs and coming back and saying, well, I was afraid to start this drug because I looked up the side effects and it was problematic. I said, well, all the drugs I give you have side effects. They're all poison. I tell them that.
Do you recommend that people, boys and girls, get the HPV vaccine?
You want me to talk about that? No. And I'll tell you what's going on. I've been talking about this for a long time. First of all, this is a vaccine. Well, we called it the help pay for Vioxx. That's what we called it in our office, because Merck had just gone through billions of dollars after they killed 100,000 people with Vioxx, so they had to come up with the most expensive vaccine in the history of mankind in order to pay off the debt, I suppose. But in any case, this is a vaccine, first of all, that's solving a problem that's already been solved. It's a vaccine looking for an issue. The reason I say that is that, as I said earlier today, one of the few diagnostic tests or screening tests that really works is Pap testing. In every country it's been implemented. The cervical cancer death rate has gone down. When you do find precancerous lesions in a woman's cervix and you treat it at that stage, you do not get cancer. And so it was unnecessary. That's the first thing. The second thing is it's based on a faulty premise, which is that the cause of cervical cancer is the virus, and it's not. The virus doesn't have anything to do with it. 79% of the people in this country have antibodies to the virus. We all cleared it. That is not the cause of cervical cancer. The biggest issue, though, is the side effects. And what's happened in the last few months gives me great joy, because it tells me that the whole thing is going to start falling apart soon. The country of Japan took HPV off the schedule, and they have set up clinics all throughout the country to help women who've been injured, women and adolescents who've been injured. They've acknowledged it never should have been approved. They've acknowledged that there are a lot of injured women in Japan, and they are addressing the problem. Cochrane Collaboration, talked about them earlier today, they filed a complaint alleging scientific misconduct and fraud against the European Medicines Agency in their safety review of the HPV vaccine. Basically what they did, just to let you know the misbehavior in the drug business, the ESA asked the two makers of the HPV vaccine that market products in Europe to review their data and report if there were concerning side effects. Okay, so that's like the IRS saying, we'd like for everybody in America to take a look at last year's tax return. If you think you made an error and you owe us some money, will you send it, please? Okay? You do not tell people to audit their own potential problem. So I think that at this point in time, this is beginning to, these are good signs that at some point we may see this, this particular vaccine and perhaps several others be taken off the market. I look forward to that day.
Should we get, well, tell me about bypass surgery, stents, angioplasty. Are these optional things, or is this emergency care? Like, how should we think about this?
Well, those treatments are typically emergency care. So primarily for individuals who have coronary disease, the primary indication for a cath and stent is if you're in the throes of a heart attack. We have data showing that for patients with known coronary disease and symptoms of chest discomfort, there's been found no significant difference in medical therapy versus angioplasty, and by and large versus bypass surgery if they have normal pumping function, ejection fraction. So in essence, what you're doing is that in every case you're treating the symptom of chest discomfort. And so you can optimize medication, and they've shown studies where individuals who get stents versus those who just get optimal medications alone There's no decrease, incidence of heart attack in those who get stents. There's no decrease in death rate. And essentially, there's only, symptom treatment of angina, which has been found to be equivalent in a population with known coronary disease. So having said that, there should be a very small number of individuals needing a heart cath or bypass surgery. Now, who might those individuals be? I have a few patients who, for instance, someone has a very specific area of ischemia that's not reversing right away with an aggressive plant-based diet and optimal medications and ECP therapy, which we use to treat ischemia as a non-invasive therapy. Then I may send those patients, a patient I just recently cathed, and we put a stent in his LAD, and it treated a very specific area that was very difficult to have, lots of calcium. So we had to use very special techniques to open up the artery and the like. So there's specialized cases like that, but that should be very few. We're doing many angioplasties and bypass surgeries that really shouldn't be done because they're done as a first line of care. And so for the most part, these therapies should be minimally used, in my opinion, and many patients have many alternative treatment plans. Obviously, the foundation being a whole foods plant-based diet, but there are other things in addition to that you can treat symptoms with short of invasive procedures. My practice, in the 20 years I've been practicing cardiology, when I started, I was doing heart caths and defibrillators and all sorts of procedures, and when I started applying nutrition, the number of procedures I do have gone down drastically because we're able to find alternative approaches for patients with these symptoms, and they're able to avoid going in for a heart cath or getting a stent or having bypass surgery.
Dr. Montgomery, not to put you in a bad position and ask you an inappropriate question, but when you're in the secret meetings with other cardiologists and you're in that atmosphere, do you feel that, we hold doctors and cardiologists to a very, very high standard. Is there ever a time that you feel that people actually would rather have patients that they could charge expensive surgeries as opposed to recommend lifestyle changes?
It's interesting. I think there's some element of that. So what I'll say is one of my attendings when I was in training would jokingly say, about some of the private attendings bringing more patients in for heart caths. He says, must have a note to pay on the boat or something like that. So we joke about those things. I think for the most part, my colleagues, and many of them are in academic medicine, they don't sort of directly attach the number of procedures they do with their income. But most of them really think that this therapy is necessary and that it works. So there's a sense of blindness that's there. I think there's another psychological component is that, training as a cardiology, you go through, after college, you get 4 years of medical school, then there's 4 years of 3 years of internal medicine training, then 4 years of cardiology, in my case, electrophysiology. So there's 11 years after you finish college, you're in school and training, and you're learning all of this stuff, and you gain all these skills and so on. And so you're practicing, all of a sudden some joker comes up and says, well, you really don't need to do all that stuff. Just a whole foods plant-based diet can turn these conditions around. You have a hard time getting your arms around it. And so there's a psychological component that I don't really want to look over there because, I'm used to doing what I'm doing. I'm stuck in this approach. But I think there's also an aspect of fear that, maybe there is something to lifestyle, et cetera, and it may, deem what I'm doing worthless. So I think there are many factors that go into that. I don't think it's strictly economic, but we're trained in a certain way, and no one looks to the left or to the right, and no one thinks outside the box. And so I think for the most part, they honestly think this is the only approach that really works for patients.
It also would reflect, of course, on the cardiologist's own diet and what's in his fridge. And they've worked very hard, like we all have, to earn enough money to enjoy those good life foods, the filet mignon and the lobster thermidor, and they don't want to give that up, and they're not going to tell their patients to give that up. And it's no small matter as far as those psychological blocks that Dr. Montgomery elucidated here.
Diet. You need, can you, better? Okay. We weren't supposed to move the mic, she told us before. Okay. So anyway, if you've been in practice for 20 years, you've told people to lose weight, change their diet. You've had patients promise they're going to change their diet, they're going to lower their cholesterol, whatever they're trying to do. And let's face it, the doctor really hopes that the patient changes his diet. The patient really intends to do it. But nobody's teaching these patients how to do it. And so what happens time after time after time is the patient who's promised, I'm going to take off this weight, I'm going to lower my cholesterol, don't put me on the statin drug until you give me a chance to do it, comes back 6 months later, his cholesterol is now 10 points higher than it was the first time he was there. So you watch that for 20 years, and then somebody says, you know, whole foods, plant-based diet, you won't have to prescribe statins and the whole 9 yards. They're going, yeah, right. Well, you can't blame the person. And so one of the things that I tell people all the time is how you can really help this movement is to be the first person your doctor meets who actually gets that done. Because it may be the beginning of turning around that doctor's bias toward drugs and surgery, which he's seen have some positive effect while he's seen nobody succeed the other way. You be the first person, and that can be the beginning of changing that particular physician's mind.
Should we, if we're over 50, should we get colonoscopies on a regular basis or whatever is recommended?
I'll take that one. You know, the Canadian Preventive Medical Association, I can't remember what they call it, but they just issued a report advising against it. You know, there's not a single randomized controlled trial that shows that having a colonoscopy reduces your risk of dying of colon cancer. Not one. And we also have tests that are much more effective. I mean, the FIT test is 80% first time around accuracy rate. And so I don't think that we should not do any colonoscopy, but I think that the choice to have a colonoscopy or the recommendation for one should be a little bit more targeted than it is at this point in time. I think we got to get away from this knee-jerk reaction of if you're 50, you do this, when you're 55, you do that, and if this market... We have too much standardization in medicine, and what's happening is we're training the judgment out of physicians who are trained to have judgment. That's why you went to school for all those years, is to have clinical judgment. And to suggest that you should abide by some list of rules that doesn't have anything to do with that judgment is, I think, dangerous. It's not just a bad idea, it's dangerous for patients.
I've got a comment about that. When I first started blogging a few years ago, I was about the time I was supposed to have my first colonoscopy, or my second colonoscopy. I'm 71, I've never had a colonoscopy, and I never will. And I started looking into it, did a little research, I found out it's a $50 billion business in this country to just screen for colon cancer. And I dug a little further and found out that oftentimes, I mean, the percentages are low, but there's something like 20,000 people a year go in for their colonoscopy, perfectly healthy, and come out with a torn colon. Now, how stupid would I feel after eating a whole food plant-based diet? Some doctor said, "Oh, you're 65. You hadn't had a colonoscopy. You better get it in there and get that now. You owe it to your health and your family, your future kids, and your college education." You know. Forget it. I'm just no longer a customer of the business. I'm not a colonoscopy customer, and I'm not a doctor, so I don't advise anybody about what they should do, but I have chosen, based on my research, that I'm not a customer.
Again, it depends on the individual person. If I've got a 50-year-old man sitting in front of me and his father, 2 brothers, and uncle all died of colon cancer at age 50, and he's eating bacon and eggs for breakfast and a cheeseburger for lunch and fried chicken for dinner, he probably ought to get a colonoscopy fairly frequently. Especially if he's had his last colonoscopy is full of polyps in his intestinal tract, he's at high risk for disease, and he should be vigilant about that. Heaven forbid the gastroenterologist should tell him, why don't you change your diet? You know, of all the medical specialties, you would think that the gastroenterologist would be so tuned in to the effect of food on their organ of concern, but that doesn't make any difference. Let them eat whatever they want. There's never been any studies to show diet makes any difference. My colleagues. But if I've got a healthy 30-year vegan with no colon cancer in his family, eating a whole food plant-based diet, had a colonoscopy a couple of years ago, absolutely clean, without the hint of any polyps, I don't think this man needs to get colonoscopies for any reason. He's not going to spout out a colon cancer. Nothing that he's eating should really spawn that. So at the most, check the stool for cult blood once or twice, in a decade, and just verify there's no bleeding happening. But again, if you've got a whole food plant-based diet going down that digestive tract, there's no reason to think you're going to spout out a colon cancer. But if you're eating a paleo diet, you better send your cardiologist a bottle of vodka every Christmas, because you're going to be seeing them fairly often.
Should women get mammographies?
Again, it would depend on the person. I think as a diagnostic tool, or as a tool for once cancer is diagnosed, to quantify it, that sort of thing, it's useful. But mammography hurts more women than it helps. And study after study after study has shown that. For every woman who you do something positive for, who you save her life, you're going to hurt 3 to 6. And part of the problem is there's a movement in oncology, which I'm very much in favor of discontinuing calling certain things cancer. In other words, as soon as we label something cancer, even if it's an indolent cancer, it's not going to turn into anything. The term cancer, everybody gets all excited. Doctors get excited, patients get excited. We have to do treatment, we have to do things. Surgery's good. So when we relabel things, like they used to call the lesions that precede cervical cancer, they used to call that pre-cervical cancer, and when they renamed those lesions, half of them go away in 6 months on their own. And as long as you're not calling it cancer, people are willing to wait the 6 months to see if it goes away. As soon as you call it cancer, surgery tomorrow, right? So I think that mammography is really good. I think the evidence shows that mammography is really good at detecting small masses like ductal carcinoma in situ. About 18% of those turn into cancer, and it takes better than a decade for that to happen. Misses the interval cancers that grow quickly in between mammograms. So I think a good argument can be made to stop using it as a screening tool. It's a terrible screening tool. And start using it to aid in the diagnosis of a cancer you have, so you can make plans to do surgery and to treat it. But bad screening tool.
Yes, Dr. Popper did an excellent presentation today on the problem with mammography use as a screening tool. If I have a specific woman sitting in front of me in my office with a specific lump in her breast, and what's the nature of that lump? Absolutely, send her for a mammogram. Although now, because everyone's uneasy about the radiation, I'll send her for a breast MRI, and you get much better imaging with no radiation whatsoever. So the technology has a use for specific people. But to shoot x-rays to the breasts of 150 million American women every year looking for densities is a recipe for disaster, and I urge you to see Dr. Popper's excellent presentation from this morning, and you'll see why that's such a bad idea.
One of the continuing themes as you ask us about various tests and drugs and procedures is that there is usefulness for almost everything that's done in medicine. There are a handful of things I think I would list that we'd be better off never doing it again, but there is usefulness for most of what we do. The problem is that if the services were only offered to the people who really would benefit, there's not so much money in it. You can't make money in mammography doing that test on women who have a lump, a diagnosable lump. It's palpable. You can only make money if you do it for everybody. And you can't make money doing angioplasty and bypass when they arrive at the hospital in the middle of the myocardial infarction. You got to do that for 500,000 people a year. And the same thing is true, by the way, in the alternative health field. You know, vitamin D is good for patients in kidney failure and nursing home patients who haven't been outside since 1977. It's just not a very good idea for the general population. And so if we would just use drugs, supplements, procedures and diagnostic tests for their intended purpose, medicine would cost $500 million a year instead of $3 trillion. Patients wouldn't get hurt. Doctors could spend more time doing other things that I'm sure would be useful.
Yeah, and the high-tech medicine it's so spread out. I mean, I practice in Houston. It's the largest medical center in the world. We have three heart transplant centers in walking distance, and we have medical centers spread out throughout the community, and 20 of them does open heart surgery. You get dialysis everywhere, MRIs everywhere. So the duplication of these services constantly drives up the cost. And if a hospital has an OR and they have a surgeon, then they have to get their numbers up. So they have to do more bypass surgery, they have to do more angioplasties because they need to get good at it. And so we have to have the alternative view in that, you know, these centers that do open heart surgery or angioplasty, these places need to be maybe one location every 2,000-3,000 miles. You know, they should be centers of excellence that are concentrated in certain areas where people are shipped to those areas only on an as-needed basis. And if we're doing the right thing in terms of lifestyle, you're decreasing the vast number of people that need these services. The problem is that we're poisoning ourselves on a regular basis, and so it becomes like a game of Russian roulette. And so you have to, and my patients will say, well, Thanksgiving's coming up, I'm going to eat some bad food. I said, well, have the ambulance by the table. Because when we're eating bad food, it's a matter of Russian roulette, and so we don't know who's going to drop next. And so that's why we have to have all these services duplicated all over the country in all of our communities, because we're just constantly poisoning ourselves, and we're creating a situation where we don't know who's going to drop next. And so we have to be ready to take the next person who has an acute illness, whether it's a heart attack or decompensated lung disease or et cetera.
Dr. Klaper, you're one of the very, very few people that has expertise on water fasting. Is this something that the general public should know about and should be utilizing on a regular basis, or is this just for special cases?
I work at the True North Health Center in Santa Rosa, California, about an hour north of San Francisco. And the basis, the foundation of our health improvement program is a whole food plant-based diet, and that is the definitive treatment for the vast majority of people's diseases that they bring in if they've been eating a Western diet. That said, it has become very clear that when the body embarks upon a water fast, amazing changes happen in the body. First of all, as I make these numbers known here, people don't have to panic in that by day 3 on a water fast, as you start metabolizing fat tissues and these molecules called ketones come into the body, into the bloodstream, they suppress hunger. By day 3 or 4, hunger's gone. These people are not hungry. And there's the energy that's used to digest your food usually on a fast is freed up, and they feel light and energetic. And it's counterintuitive. You think you're going to be weak and tired and hungry and whimpering on the bed, and the opposite is true. They're not hungry, they feel light and energetic, they stop me in the courtyard. Doc, I haven't felt this good in years, I haven't eaten in 3 weeks, but I feel wonderful. And so when I say that we do long fasts there, the usual is 10 days, 2 weeks. But 3, 4, up to 40 days is as long a fast as we will supervise. During this time, we are now learning that the body shifts into a remarkable gear. It realizes that energy is at a premium, and it will not waste energy driving inflammatory reactions, and so we see sore rheumatoid joints cool off, we see asthma clear, we see migraine headaches go away, and molecules called sirtuins are produced in the cells that have a profound anti-cancer property. We see breast cancers and malignancy stop growing. It's a remarkable state. And for that reason, we often recommend water fasting to get the person a leg up or a head start, a jump start into controlling the runaway high blood pressure, diabetes. And if there was a pill that lowered high blood pressure, cleared out insulin receptors, so diabetes goes away, cooled off inflamed joints, cleared out migraine headaches, asthma, cooled off inflammatory bowel disease, we'd be trillionaires. But a water fast will do this. That said, I make it very clear to my fasting patients and in my lectures to the patients who are attending that you can do a 40-day fast. It's a blip on the screen in your life. What matters is what you eat after the fast. Because you get all these wonderful improvements, but if they fall back into chicken and cheese and olive oil swamps, then all the symptoms come back within days. The blood pressure goes back up, the weight comes back, the asthma comes back. And we make it very clear that a water fast is a stepping off place to a whole food plant-based diet, which will keep these beneficial changes happening. So there's a little magic in a water fast, but also there's nothing magic about the water fast. It's the food that you run through your body day after day, week after week, month after month that makes the difference. So with that understanding, yes, a fasting program can certainly be beneficial. Can people do this at home? And I have on my website, on drklaper.com, I have my video on fasting. And if you want to learn more about the realities, ins and outs of water fasting, go to drklaper.com, all spelled out, and you'll see my webinar on fasting. That said, anyone who's completely healthy, you're not on any medications, you're not seeing a doctor for any diagnosed disease, anyone can do a 3-day water fast at home. And I have patients who will, from Friday to Monday, just drink water. It's like taking your cells to the car wash, and day after day you're running clean water through your cells, and you wind up light and clean. It's a lovely reset. We're now learning the power of intermittent fasting, where patients will either do a fast 1 day a week, and even that is beneficial, or to do a daily fast from when they get up to just drink water till noon, and continue your nighttime fast for another 4 or 5 hours until noontime before you start your whole food plant-based diet. And this has benefits as well. So it's an exciting new scientific frontier on an ancient therapy, but it turns out there's a powerful scientific validity behind it. It's something to consider, but again, it's a stepping off place to a whole food plant-based diet that really has the real magic to affect long-term improvements and cures in these diseases. But yes, it has a tool worth learning about. Again, go to my website, drklaper.com, and watch my fasting video, and you'll learn more about it.
If a patient comes to you and you test them, or they come with tests already, and it says they have 20% kidney function left, an 80-year-old man, what do you tell them to do? What do you do when your kidney's already down to 20%? What should they do?
We see a lot of patients coming in with advanced kidney dysfunction. In fact, a lot of people come to us, when they've been told, well, you need to get ready for dialysis. And so we put them on, of course, a whole food plant-based diet. We start them on raw. We put them on extensive raw foods. We may do a little juice feasting intermittently with that. And we do see, recovery. Some of the difficulty is that you get initial recovery, and then it's just a matter of, maintaining compliance. But interestingly enough, the nephrologists will routinely tell the patients to decrease the protein in the diet when they get to the later stage renal dysfunction. So they'll say go on a low protein diet, meaning decrease the amount of animal protein that you're consuming. We just take them to the logical extent of just removing all of it. And we've had good results in terms of patients get a GFR of 20 or 15. I'm treating a couple of patients now who are right on the threshold of needing dialysis, and we're just keeping them just above that threshold with a plant-based diet. But sometimes it gets a little bit difficult because when patients start to feel better, you know, they have a bite, drop a crumb, similar to the earlier example you gave. Well, I just ate a little fish every now and then, or I went on a cruise, and when you're at that stage, you have very little reserve. So those patients can be very tricky because you can turn them around, but the difficulty is keeping them on, you know, a 100% plant-based diet, keeping them off preservatives, keeping them off, you know, even eating oatmeal at a fast food place will have chemical preservatives and various things in it. And so they're thinking they're eating oatmeal, but it's oatmeal plus other garbage. And so you have to be very precise, and we have a food classification system that I talk about in my book, and it not only talks about what you eat, but how the food's prepared, and they follow up with our nutritionist. So you have to be very careful with those patients. And the key part is being very precise in terms of prescribing food for these patients.
The kidneys, these amazing, stunning organs, are pressure-driven filters. They require a head of pressure to force that blood through the kidney filter membranes. And the most common cause of kidney failure is blood vessel disease, as atherosclerosis that clogs up the coronary arteries, also clogs up the renal arteries going to the kidneys. The blood flow gets choked down pretty rapidly. Poiseuille's law in physics says that the radius, the flow of a liquid through a tube, blood through an artery, will decrease by the fourth power of the decrease of the radius. And so as those arteries choke down, the blood flow diminishes rapidly, the pressure diminishes rapidly, and their filtration goes down. Well, Poiseuille's law works in reverse, and on a whole food plant-based diet, as the plaques start melting away, both in the big renal arteries going into the kidney, as well as all the thousands of small arteries inside the kidney, if they open up just a little bit, due to Poiseuille's law, you get this huge increase in blood flow, increased by the fourth power of the radius. And so we not infrequently see people who've been told, oh, you're headed for dialysis machine, this thing is irreversible. You get them on a whole food plant-based diet and start melting away those plaques even a little bit, and we see these increases in glomerular filtration rate. We see the increases in kidney function. And so now if the person had their kidneys poisoned from mercury or whatever, that's something else. But for these folks who have this common vascular blood vessel cause of their renal failure, they're far from hopeless, and you can at least stabilize it, if not improve their kidney function. So absolutely, plant-based nutrition to the rescue for these folks as well.
I was just going to say, don't you find it interesting that the nephrologist recommends the low-protein diet when they're heading toward kidney failure, instead of to keep them from heading toward kidney failure? Everybody, they're crystal clear when they get to that point, but up until that point, it doesn't matter what you eat.
To be clear, what are the best parts of the medical industry that we should be utilizing? What tests should we make sure that we should do? What procedures? So what are the parts that you do like and would want to make sure that we utilize?
When I was in training, my resident in emergency medicine says you can divide all of medicine into two types. There's horizontal medicine and vertical medicine. If you are so sick or injured that you are horizontal on the gurney, boy, Western medicine is what you need. And boy, they are wizards at pulling you out of death's doorway there. And thank heavens for all the emergency trauma surgery and all the antibiotics for septic shock. And modern medicine is just stunning in its power to deal with people who are in extreme medical dilemmas. But that's 10% of medicine. 90% of medicine is vertical medicine. If you are vertical and walking around and you have these chronic diseases that most of Western medicine says, etiology unknown. We don't know what causes high blood pressure. We don't know what causes type 2 diabetes. We don't know what causes clogged arteries. If you're dealing with doctors who are trapped in that way of looking, there's not going to be much they're going to offer you. Most people know when they're sick, and you go get treatments for specific diseases, but I think that most of the screening that is done should be, needs to be discarded for the reasons we've talked about. So I'm all in favor, as an old anesthetist. Magic can happen in the operating room, but a lot of disasters and troubles can be brewed there as well. So I'm for most everything that has to do with acute care medicine. But as far as chronic disease care, unless they're talking about I ask every patient, take me through your eating day. What, from breakfast, lunch, or what you really put in your mouth. Until physicians start asking that question to every one of their patients, they're going to be treating symptoms or making things worse. So in answer to your question, has to do with the acute care medicine, but the chronic care has a long way to go until they recognize the importance of their patient's diet.
Yeah, and I tell my patients, in fact, this is one of my talks, is that the diagnostic and therapeutic tool of the 21st century is the meal plate. And that's the #1 screening and treating tool that we have, or should have. And if you remove all the causes of diabetes and arthritis and high blood pressure, et cetera, from your meal plate, then that's the first line of therapy. Because, you know, I can do all the tests in my office. We do nuclear stress, PET scans, we do a whole gamut of things. And all the tests can come up normal. And you can still have some pre-level biochemical abnormalities, some disease state that we miss. We can actually do an angiogram. I have images showing an angiogram that looks quote-unquote normal. But then if you put an ultrasound wire across those arteries, you see plaque inside the arteries. And so we've had patients go in and get an angiogram, so your arteries are normal, the cardiologist will tell them, and then a month later they have a heart attack. I've cathed the patient who came to the emergency room in the throes of a heart attack, and I did an angiogram. And by the time I got him to the cath lab and took a look at his arteries, the thrombus that had occurred, that formed and caused the heart attack, had dissolved, and the remaining part of the arteries looked normal, quote unquote. And so all of our tests, while they can be helpful in certain settings, disease states start at the cellular level, the subcellular level, and we really don't have any tests that can pick up these diseases at these early stages. It's only if you know that you're putting bad food in your mouth that you have some level of disease. The disease state is not an abnormal blood test. It's not an abnormal imaging study. It's not an abnormal angiogram. The disease state is abnormal stuff going in your mouth. And so if you have one bite of chicken or one bite of fish, then you have a disease. It doesn't matter what my tests show. And it's only a matter of reversing that disease. It's reversing the process of putting bad food in your mouth. That's in essence what we have to do.
I think one of the problems with population screening, with very few exceptions, is, and it goes to your point, that that's really, we're measuring the wrong things. We're, instead of backing it up and measuring what the lifestyle factors are, but it encourages this mentality that I'm going to eat, drink, and be merry, and then I'll visit a doctor or 2 or 5, depending on what's going on with me. I'll have tests done. They inevitably come back, you're okay. Remember Tim Russert, I said this afternoon, 6 weeks before his fatal heart attack, he was okay, whatever that means. But you get the okay, and then people say, well, I guess I can just go back to sitting on the couch and eating cheeseburgers and French fries, and I can get tested next year, and I'll see if I'm still getting away with it. They don't really verbalize that to themselves, but that's essentially the philosophy that people are practicing. I'm going to do it until I can't get away with it anymore. Okay, now apply that to anything else. I'm going to drive my car, I'm going to run stop signs until something bad happens. I mean, what kind of a strategy is that for driving a car? But that's exactly the way people conduct their health lives, by the way that they eat. So diagnostic testing should be used very, screening and population screening I think is a very bad idea, and these screening tools have some value, but if we use them more judiciously, we would get rid of that thinking that you show up, you get cleared, and then you just go on and live your life waiting until the next time.
Little boy was caught masturbating by his parents, and his father says, you keep doing that, you're going to go blind. And the boy says, well, can I do it just till I need glasses?
So if someone is watching this and they're saying to themselves, why should I listen to a word these people are saying? Uncle Joe lived to 94. And, I don't take this whole lifestyle stuff that serious because he lived to 94. He never ate healthy or exercised.
Well, a quick comment. You know, there are reported cases of people, you know, who jump out of airplanes and their parachutes don't deploy. And they, you know, land, of course, break some bones, but they live to tell about it. I wouldn't advise someone to jump out of an airplane without a parachute. I mean, there always will be exceptions to the rule. And so there are often extreme exceptions to the rule, but you don't use those exceptions as a source of your advice.
I was going to say, it's storytelling. And if you read Lauren Cordain's book, The Paleo Diet, that's what it's all about. It's storytelling. There's no science in there. I mean, you know, Anne was eating pizza and bagels and ice cream every day, and she stopped eating pizza and bagels and ice cream and started eating ox and moose and you know, whatever they do on that diet. And she got well. There are no blood test results in the book. There's no reference for the fact that not even a good case report, let alone evidence to suggest that this would happen to other people who took that same course of action. So I hear that all the time. You know, people report a story, and I always tell them, I believe you. I believe that happened. I believe your Uncle Joe lived to be 94, and he ate bacon, eggs, and cheese 3 times a day and died in his sleep. But as Dr. Montgomery said, the reality is that that's not likely to happen to you. The odds are not in your favor.
Yesterday, that Hillary Clinton is on statin drug and a thyroid medicine, and that Donald Trump is overweight. That was what the medical reports that I read. How would so I guess thyroid medicine, I'm not sure if I just was never aware of the issue. I never heard about thyroid issues when I was young. I hear about it, it seems very often, maybe more with women. What should you do to prevent having a thyroid problem?
Well, there are different types of thyroid problems. One reason why women develop thyroid problems, why I think it's happening more often, is because high estrogen levels depress thyroid function. And one of the contributors to high estrogen levels is eating dairy. I mean, you're actually eating estrogen. By the way, if you want somebody to really give up the dairy habit, explain to them that estrogen and estrogen metabolites are in all dairy products, doesn't matter what animal it comes from. So I always tell people who think they can't give it up, you know, I want to reframe the thing for you here. So instead of saying I'm going to pour some milk on my cereal, I'm going to pour some estrogen on my cereal, because nothing is better with cereal than estrogen. I'm going to put a slice of estrogen on my sandwich, because a sandwich that has estrogen in it, it's so good. Then they'll go, ew. I said, that's the point, right? Ew. But women have high estrogen levels for a couple of reasons. Their diets create this problem, and also the extra weight that they carry, because fat cells produce hormones that are converted to estrogen in the bloodstream. So if you want to prevent your normal everyday hypothyroidism, which is predominant in women, lean down, get off the dairy products, start exercising, lower your estrogen levels. That's one thing. Another cause of hypothyroidism is autoimmune hypothyroidism, and that's a lot more complex topic, but basically rooted in the same thing. One of the quickest ways to develop an autoimmune disease is to eat terrible food and abuse your body on a daily basis. So, you know, we keep coming back to the same thing regardless of the disease, right? It's you got to eat a plant-based diet. You know, yeah, it's one disease. Dr. Esselstyn said that once. He said, I think it's just all one disease. It's caused by bad eating, and then we give it different names because that lets drug companies develop specific products that they can sell at very high prices. But it's just one bad diet. But one disease called bad diet.
Yeah, and there's different manifestations of one disease. So if you have 1,000 people in the room, and let's say I gave you all fast food 3 times a day for 6 months, some would get high blood pressure, some would get elevated cholesterol, some of you would get depressed, some would get overweight. You'd have a variety of different manifestation of one disease, which is malnutrition. And so that's what we're dealing with. And so, you know, we have, you know, Hillary Clinton on a statin drug. That means her cholesterol is up, which means she likely has coronary disease. Donald Trump eats Kentucky Fried Chicken by his own admission. Doesn't matter what his numbers are. You know, he likely has coronary disease. The prevalence of the likelihood that they both have coronary disease is virtually 100%, in my opinion. And so, yeah, she has hypothyroidism. The fainting spell was likely probably a common vagal spell she had that, you know, she may have had before. But the other concern is that she has a hypercoagulable state. She's had cavernous vein thrombosis, she's had deep vein thromboses. And so basically that's a sign of a poor biochemical state, poor biochemistry and physiology. Sometimes perineoplastic syndromes can give hypercoagulable states. But oftentimes patients whose biochemistry is off whack throws their coagulation enzymes and molecules off balance, and so they're predisposed to either clotting in some cases or bleeding in other cases. And so basically both of them are in poor biochemical health, just based on the lifestyle. And it's not just campaigning hard, et cetera, it's pretty much what they're putting in their mouths.
Yes, I'm concerned when I look at Ms. Clinton, and she's clear. You can see the dairy eaters when I walk in my office, and Mr. Trump and Ms. Clinton both have that bloat and that dairy eating look and the large derrieres and the derriere. When's the last time you've seen heard that word? It's delicately phrased. And the dairy industry did something that was very profound. They didn't tell us about it. I did most of my growing up on my uncle's dairy farm in Wisconsin. And back in the 50s, when a cow came into her fertile period, we'd lock her up in a stanchion, and the man from Badger Breeders would come and ram that tube of bull semen up into her uterus there, and she would become pregnant. And shortly after there, she would stop giving milk. Pregnant mammals don't lactate, and there's a good reason for that. And on my uncle's farm with 40 Holsteins, he just accepted that, and he realized that most of his prize milkers would go off the dairy production line 4 months at a time till they had their baby and start lactating again. Well, in a modern dairy operation with 2,000, 3,000 cows, they can't afford to have their best milkers come offline for months at a time. And so the smart agricultural scientist says, we can solve that problem. And they have genetically modified the cows. And now they will give milk all the way through their pregnancy. Even though they're pregnant with their next calf, they will lactate all the way through. So now every can of milk, every container of Greek yogurt, every slice of mozzarella cheese on the pizza are made from the milk of pregnant cows. The estrogen content of this is through the roof. And as Dr. Popper just said, this has ramifications throughout the life cycle. Why are little girls going through puberty at age 8 and 9 and 10? Could it have something to do with this river of milk and cheese and ice cream and yogurt they're pouring down their gullet full of cow estrogens? Within 15 minutes of drinking a glass of milk, their urine is pouring with estrone, estradiol, estriol, pregnanediol, progesterone. These are potent mammalian estrogens, not the puny little phytoestrogens in soy. These are official mammalian estrogens, and they are active. Get your mammograms, ladies. Why do American women get all these breast lumps? It's not normal, not natural. Go to rural China, you don't see women with breast lumps yet. When the American diet metastasizes over there, you'll see it. You go to rural Vietnam, you don't see women with breast lumps like you do here because they're not consuming the dairy at this point. Guys sitting on the couch eating their deep dish pizzas and their cheese nachos look down, hey, where'd I get these man boobs? Fella, you're eating cow estrogens. What do you think is going to happen? And every 100th case of breast cancer is in a man. These estrogens make the prostate gland unstable, and if a woman has breast cancer and she's eating baby calf growth fluid with all these estrogens, like throwing gasoline on a fire, and they die harder, faster deaths from their breast cancer. So the estrogens that were referred to are no small matter here, and I can see it in both Ms. Clinton and Mr. Trump, and I don't care what his numbers look like. What's really happening in Mr. Trump's prostate, what's really happening in his colon wall, what's really happening in his arteries, is nothing good, I'll guarantee, and just a matter of time before they manifest. And finally, what Dr. Montgomery said is absolutely true. It's the same disease, and it bubbles up through all these organ systems. And the internist sees the high blood pressure, and the cardiologist sees the angina, and the gastroenterologist sees the colitis, and the rheumatologist sees the sore joints, and the dermatologist sees the psoriasis. They're all looking at the same disease. It's the classic blind man and the elephant, and one's got a hold of the trunk, and the elephant's like a snake. The other one's got a hold of the tail, it's like a rope. The other one's got the leg, it's like a tree trunk. They're all holding the same elephant, and it's the food that is manifesting in all these different organ systems. So the meat, the dairy, all of them has become so toxic and in a synergistic blend of evil and power. And so until I hope President Trump starts helping some legislation get passed to help American change to a plant-based diet, I'll believe it when he orders veggie burgers. So stay tuned, but don't take any comfort from whatever laboratory results he put forth, whatever. These are not, neither of them are healthy people, as was brought out here. Stay tuned, the story's far from over.
One observation, I don't know the Clintons, but just from observing, Bill Clinton has been pretty good at sticking with this diet. We have a couple of mutual friends, and I've been told that. But if you notice, when Hillary got off the road from being Secretary of State and she was home, she leaned down, she looked better, and I surmise what was going on is she was eating at home, and she was eating that diet, mostly. Then as soon as the campaign started, and she wasn't home all the time anymore, did you notice every time she'd make an appearance, she'd get bigger? And I think what's happened is that she doesn't adhere to the diet when she's on the road, and she's blown up like, she's almost as big as she was when she ended her term as Secretary of State. So she's the public picture of what we're talking about. You eat well, the weight comes down, she looked healthy, her skin cleared up, her hair looked good. You know, she really did look more her age instead of 10, 15 years older. And then she ate herself right back into the way that the condition she was in. And my guess is that when she's in one place again, particularly if she's around people who eat well, you'll see all that weight go away again.
I'm not positive. I believe that I have my statistics right in this, and I believe that I read that the medical industry is the largest industry in the United States. Like 22% of the whole country's business was medical. And then I believe that I read that among medical, the #1 part of it was oncology. So my question is, most of us would never question that. We think of oncology as the purest of the pure, loving, smart people who are, only giving us treatment if needed. Is there anything that we should know about chemotherapy or cancer treatment that we might not be aware of?
It's great for weight loss. Chemotherapy, no one should need it. In my lifetime, when I was a young doc in the 70s, you got diagnosed with leukemia, it was a death sentence. And much to my amazement and joy, I have seen many forms, especially childhood leukemia, become imminently curable from from chemotherapy. And it's getting better and better as they're getting away from the bad old poisons onto these new biological agents. And there's a lot of promise in this. But again, the majority of these cancers are from what we're eating and how we're living our lives. And the oncologists who aren't getting that information out are not serving the greater good, to say the least. I've had 2 patients now in my practice with significant lymphomas. Lady came in with lymph nodes the size of hen's eggs, and the other lady had a mass in her central abdomen the size of a cantaloupe. Biopsy-proven lymphomas. They went on, one went on water fast for 28 days and a squeeze squeaky clean plant-based diet, those nodes just melted away, and her last MRI was clear. The same thing with the older woman with the mass in her abdomen. She went on a prolonged juice fast for about 2 months, and the lymphoma melted away. And Ruth Heydrich, a friend of mine, had metastatic breast cancer, and a whole food plant-based diet reversed that. Dr. Ornish has showed repeatedly that prostate cancers are driven by fats and hormones in the diet, and a whole food plant-based diet can stop many forms of prostate cancer in its tracks. There's a huge nutritional component to these diseases. Of course, not surprising, because they are, they're largely driven by that. Any oncologist that is not having whole food plant-based nutrition as the foundation of their program is not serving their patients well. To give them chemotherapy and say, oh, you can eat all the cheeseburgers and pepperoni pizzas you want, I think is way below standard of care these days. I refer all my oncology patients to Dr. Keith Block near Chicago. He's a plant-based oncologist, and he knows the power of plant-based nutrition, and they do a superb job there at optimizing. They use standard chemotherapy agents as well, but their patients do much better because attention is given to what their patients are eating.
And I see a lot of patients who are on chemo, radiation therapy, and many of these drugs have adverse effects on the heart. And oftentimes they have to come and get cardiac screening. You get coronary disease in the setting of radiation therapy, congestive heart failure with some of these chemotherapeutic agents. So they're not without their side effects. Having said that, as Dr. Klaper mentioned, we have seen advances with some of these newer agents. Some chemotherapeutic agents have shown a benefit. The problem is that, as it is in the case with other forms of acute care medicine, is that the doctors will give a pharmacological treatment or surgical treatment, and the patient will get into some level of recovery. Oftentimes patients are in remission. But the problem is that they don't get the advice to take the #1 chemotherapeutic agent, which is a whole food plant-based diet. And the science is there showing that the blood of plant-based vegan individuals kill cancer much faster. And so you go only part of the way. You get your bypass surgery and you're not given a whole food plant-based diet, or you get your stent, you're not given a whole food plant-based diet. You get your chemotherapy, you put in remission, you're not given a whole food plant-based diet. And so we don't give them the complete therapy, and that's really the biggest problem that I see.
I think the disease where informed decision-making is the most important is oncology, cancer. And the reason is this. If you're a type 2 diabetic and you take metformin for 3 years, and then you find out about whole food plant-based nutrition and you change your ways, you get off the metformin, it would be better if you hadn't taken the metformin, but the decision is recoverable, okay? If you have cancer and you choose the wrong treatment and you realize at some point in time that what you're doing isn't effective, you may not be able to do anything about it, because when you choose the wrong treatment, particularly if it is chemotherapy or some type of aggressive radiation, not only does the cancer mutate and grow back, and we know that happens, but your body is in a weaker position to deal with it. And so what people tend to do is, in a state of emotion and fear and pressure to start treatment immediately, which most of the time it doesn't have to be done immediately. It won't change if you wait 3 weeks and figure out what's going on and then start treatment if that's what you decide to do. But in a stage of just pure terror, which I can understand, they start treatment, and then 6 or 7 months down the road, this isn't working out so well, so now I better start looking. It's a Hail Mary pass, like I'm looking for some kind of miracle, and they end up in my office or somebody like me trying to figure out what to do, and sometimes we can fix it and sometimes we can't by guiding them to some other form of treatment. So I've written papers about this. What advice to a cancer patient, the first thing is take a deep breath and make up your mind that you're not going to do anything until you know the risks and the benefits and all of the options available to you. And one of the first things we have most patients do is to get a report from cancerdecisions.com that tells them how they developed this cancer and all of the options for treatment that are being recommended by most traditional oncologists. and in real terms, not relative, but absolute terms, what the risk reduction is for recurrence. For example, if you have early stage cancer, radiation reduces your risk of recurrence by 2%. 2%. Now, some people might think 2% is a lot. My experience, most people looking at that say, yeah, I don't really think it's worth it. Sometimes the chemotherapy is very aggressive, reduces the risk of a recurrence by 7%, and you find out that 39% of the women dropped out of the trial because the treatment was too severe. Well, some people look at that and say, I'll take the 7.5%. Other people say, yeah, not so much. So it's very important to do all of this decision making, and then again to make it an evidence-based discussion, because what happens as soon as the cancer patient says, I might consider something else, is the parents, everybody who cares, starts saying, your oncologist is the head of the medical center at the XYZ university, you better do what she says or what he says, and all the pressure in the family and friends descending on the person. So we even help role play in the office what kind of conversation we're going to have with these people. We're going to time limit the search for options, because if people think it's going to go on forever, listen, I'm going to take 4 weeks or 6 weeks, I'm going to look at all these things. I promise I will sit down with you and show you what I've found before making a decision and get your input. And if the evidence is presented to family members, you'd be surprised how fast they cool off, because they drank the medical Kool-Aid thinking all this stuff works too. So in some instances, chemotherapy is a good idea. And if it is, then clear head, you go right forward and do it. When it's not, better to know before rather than after. So, and for terminal cancer patients, I mentioned this earlier today, the first thing we have them do is read Kelly Turner's book, because everything they're hearing is that they're going to die. They need to hear about 1,000 people who lived and how they did it. And that's the book that will tell them about it.
What do you recommend for someone who is eating a plant-based diet and has constipation? What should they do?
They should eat a whole food plant-based diet. If you are eating a whole food plant-based, if you are having oatmeal for breakfast and lunches and dinners are big salads and hearty vegetable soups and whole grains and steamed green yellow vegetables, there's no way that you are not going to be passing large, soft form stools once, twice, or 3 times a day. But you can be vegan living on granola bars and energy drinks. And if you do that, you're going to wind up constipated. And vegetarians, if they include dairy, which is notoriously constipating. Again, that same question to that, take me through your eating day. What are you actually eating? What did you eat yesterday? Take me through yesterday's eating day. What did you put in your mouth? And the story comes out. And if they're eating a truly whole food plant-based diet and drinking enough water, if you are, especially in hot climates, if you're not drinking enough water and have a low-grade dehydration, your body will take water out of the stool in your colon to keep your water balance up, but as a result, the stool gets harder and drier. And so often constipation is a sign of dehydration. So make sure there's enough water intake going in. But if they do that and eat a truly whole food plant-based diet, if they got constipation, then I want to make sure they don't have a low-grade bowel obstruction or something else. But by and large, it's what the kind of diet we're talking about is the definitive therapy for constipation. I have not met very many constipated vegans, to say the least.
How do we prevent bone diseases like arthritis and osteoporosis? What can we do to avoid those two things?
Osteoporosis is not a calcium deficiency. Osteoporosis is disuse atrophy of the bones. We have become sedentary. We used to spend our lives out hauling firewood and working in the garden using heavy tools, and every step you take carrying a basket of anything that has weight sends a little gravitational wave down your bones that wakes them up and makes the osteoblast in your bones spin out new bones. People who are physically active doing weight-bearing exercise should not get osteoporosis, especially if they're not doing things that damage their bones, like drinking coffee, too much salt, too much sugar, soft drinks. These things increase the dissolution of the bones. So the whole, and again, go to my website, drklaper.com. I've got a webinar called Healthy Bones, and it goes through all of this in detail. Arthritis means inflamed joints. First of all, most people with sore joints do not have arthritis. What they have is inflammation of their ligaments and their tendons from how they're using that joint. These are low-grade athletic injuries. If just one hand is getting sore, oh, doc, I got arthritis. What are you doing with that day? Oh, I'm flipping hamburgers all day. Well, this is not arthritis. This is an inflammation of the tendons, ligaments, and supporting tissues. There's also a whole breed of arthritides of the inflammatory kind. These joints are sore, but it's coming from the gut. They've injured their gut lining through too much sugar and alcohol and chlorinated drinking water, all those things that kill off their gut bacteria. Their guts have become more permeable, and food proteins and cell walls of bacteria are leaking into their bloodstream and flowing through their joints and setting off inflammatory arthritis. These folks need to, again, adopt a whole food plant-based diet, maybe get on some probiotics and a few supplements that will help heal their gut and heal their joints. Again, go to my website. I did a webinar on leaky gut, and you can find out that protocol there. It's the food, it's the food, it's the food. Very rarely, if someone comes in with a destroyed hip joint from carrying too much weight for too many years and they just ground down that joint, you asked what good things Western medicine came up with. Joint replacements are one of the best, along with cataract operations. They are both miraculous procedures if you need them. But by and large, start with a whole food plant-based diet, get yourself lean and trim, and take a walk every day, and most of those joint problems go away.
So would you each like to make a closing comment to sum up your thoughts for this evening?
We'll let you start.
Yeah, I haven't said anything lately. But I sit in here and listen to these great doctors, and I've heard the phrase whole food plant-based diet about 900 times tonight. But the odds remain in this country that there's about a less than 1 in 10 chance you're going to hear that from the average family physician. And so my question, I guess, to them and the whole medical community is, how long is it going to be before we teach this in medical school? Any medical school. It seems like we're nowhere. You guys learn from somewhere other than medical school. And a lot of people are suffering and dying when it's obvious to you and everybody else in the room that the whole food plant-based diet can cure most of what's wrong with us and wipe out 80% of our cost of health care and save $2 trillion to our economy. What's wrong? What's it going to take?
It's hard to change institutions. It's very hard to change institutions. And there are a lot of good people inside of the institutions that we need to capitalize on, I think. And I agree with you, we need to teach this in medical school. But I still say that the way that we're going to change this is grassroots. This medical system will shift. Let me give a comparison that I think will illustrate the point and make you feel really hopeful about this. Because I don't think I'm stupidly optimistic. I think I'm optimistic for a reason. 24 years ago when I started eating differently, I remember going to restaurants and I would say I'm a vegetarian. They go, "Oh, you're a veterinarian?" And I would say, "No, I'm a vegetarian." Nobody even knew what I was talking about. And the grocery stores, there's a Kroger store about a mile from my house, and it had this little section. I'm not kidding. It was about this wide, okay? And they called it health food. All right, and then you'd look around the rest of the store and say, "What is this?" Right? What's the rest? And we had a couple of health food stores, and they were such strange and unusual places that we used to do field trips to the health food store because you had to wear your beads and sing Aquarius when you went there. And so we were afraid that if we sent people unaccompanied, they would never go back, which was pretty much the truth, all right? So now I want to tell you about what it's like in Columbus, Ohio today. The Kroger store that I mentioned, still a mile from my house, has been remade into a Kroger marketplace. Everything any of us in this room want to eat is there. It's a mile from my house. Now, I love going to Whole Foods. We have 2 ginormous Whole Foods. We have 3 Trader Joe's. I think they're building a 3rd Whole Foods. But the bottom line is, without ever making a trip to a specialty store, Kroger has it all. Kroger has it all. The health food store that was like the size of my bedroom is now occupying what used to be a full grocery store. It's huge. You can't operate a restaurant in Columbus, Ohio, that if you don't offer something for people like me to eat, and they all do. They all do. I can't remember the last time I was in a restaurant. Maybe they had to fix something special for me, but I haven't left hungry in 15 years from someplace. So why did this happen? Here's what I'm getting at. Why did this happen? Do you think that all of the grocers and the people who serve food got together in Franklin County, where Columbus is, said, you know what? We are such benevolent folks, we business people. For the good of the people who live in this county, we're going to change our operations and offer healthy food, and we are so sure that it'll work that we're willing to make the investment and hope that the customers show up to buy it. Is that how this happened? No. What happened is people started asking for it. And when people start asking for it, the marketplace responds. All right? So we've got to stop waiting. Nobody waited for grocery stores to come around. We started walking into grocery stores and telling them what we wanted to buy. We started walking into restaurants and telling them what we wanted to eat. And the restaurants and all the food purveyors in the country are pretty much hip to the situation now. So what we have to do is we have to start demanding the medicine we want to receive. We've got to make sure that everybody in Houston knows about Dr. Montgomery, and he's so busy he can't go home at night. Because if we patronize the great doctors, we'll starve out the bad ones. That's how the marketplace works. And that gives every single person in this room and every single person watching this video the power of your checkbook. You have the power. Use it. Every time you buy something, and I tell our members this all the time, every time you buy something, you're saying, this is okay with me. That's why you don't buy conventionally raised animal foods anymore. You're saying it's okay to put 10,000 animals in a building and produce all that excrement that you heard about earlier tonight and beat cows with crowbars. You're saying, that's okay with me. I just wrote a check for it. All right, so think about the power of your checkbook. You don't patronize medical institutions that are not friendly to this type of cause that we're talking about. You don't go to doctors who are arrogant and don't listen to you. You go to the good doctors. You see Dr. Klaper. You see Dr. Montgomery. And over time, and it won't take long, over time, you'll see the same kind of shift in medical care that we've seen in the food offerings and restaurants and stores. This is a fixable problem, but it's up to us to fix it. We have to be the busy ones, right, in the consumer movement. That's how it'll get done.
Yeah. I agree with that 100%, and often when I'm talking to my clients in our boot camp classes and my patients, I clearly tell them, don't expect the world to change for you, expect yourself to change the world. And really, you all are part of a movement. And once you make the decision to consume only the food that's best for you, you've already started that movement within your own circle. Because people are watching what you do, they're watching your every move. You may have friends, neighbors, families, etc. And they're seeing what you do. And I'll tell my patients that, I have a patient whose family doesn't want to change, their spouse doesn't want to change, they go to family reunions. So don't worry about that. Let's start with you. And you start making changes, you start reversing your illnesses, you start reducing your medication list, and you just say nothing else. Let your actions speak for you. And you start to see family members change. But there's a grassroots change that's happening. I'm seeing it even in Houston. You go to places like New York and they're just exploding with plant-based restaurants. I mean, it's just enormous, every other corner on the East Coast. But it's happening all over. And I'm seeing a change. I don't know if we're quite at the tipping point yet or how close we are, but I'm starting to see the change in this environment. And I've been in this area for about 12, 13 years, noticing eating plant-based myself and being aware of this. And in that short period of time, I'm seeing a very significant change in the places I work and the places I speak. And so I'm very optimistic about the future. I'm optimistic about our outcome as a country in terms of health, but we can't be complacent. We have to continue to push. We have to continue to deliver the message. We have to continue to educate each other and keep this movement going.
Absolutely. And I'll contribute by hopefully ending us on a more optimistic note, continuing with what Dr. Popper and Dr. Montgomery just said. Next week, I'm going down to Anaheim, and I will be speaking at the 4th International Conference on Plant-Based Nutrition in Healthcare. And this is the 4th year that physicians from around the world are coming to talk about how they are using plant-based nutrition in their practice. They come from literally around the world, from India and Israel and Australia and the UK and Canada and South America. They're coming from everywhere, and every year we have hundreds more coming. This is a very, very positive sign. The following month, I'm going to the University of Rochester Medical School. I'm sponsored by PCRM, Physicians Committee for Responsible Medicine, and they are sponsoring me on a speaking tour to go around to the medical schools and give the 3rd and 4th year medical students the lecture that I wish somebody had given me when I was a 4th year medical student, and to tell them that, listen, you're not going to be seeing bubonic plague and Tsutsugamuchi fever. You are going to be treating patients with degenerative diseases from what they are eating. And until you recognize this, you're just going to be treating symptoms. They're going to get sicker. You're going to get frustrated and leave medicine. Plant-based nutrition is the key if you're serious about getting your patients healthier. And it's time for you to understand this and become skilled in this kind of counseling, no matter what specialty you go into. It's the food, it's the food, it's the food. Don't relegate your patients, send them to the dietitian, they'll give them a diet. You find out what your patients are eating and help them move into the plant-based world. So the light is going on in the minds and hearts of physicians around the world, and the 100th monkey phenomenon is slowly, we're probably in the medical profession, we're at monkey number 24, but it was monkey number 10, 5 years ago. It's slowly happening. And what Dr. Popper said is absolutely right. One of the major impetus for doctors to open to the plant-based idea is what their patients are telling them about the books they read, about the improvements that their husband just made when he went on a plant-based diet. Doctor, is this working for me? And slowly, our patients are our best teachers, and we all know that on this side of the stethoscope. And our patients are telling us that plant-based nutrition is the definitive therapy for the majority of diseases. So, assuming the world holds together for another 10 or 20 years, I think we will see the very things that Mr. Hicks is exhorting us to bring into being here. You're going to see the plant-based ethos sweep through the medical profession, because it's the only thing that really works. And when we stop getting defensive and we're afraid to, and stop being afraid to let go of old concepts that didn't serve us any longer, and fully open to this ancient yet very modern therapy of whole food plant-based nutrition, you'll see the medical profession really assumes the honest mantle of giving true health care. And this is happening, and you all are proud of this. All of us are practicing this very, very powerful form of medicine. We're practicing it tonight. It's going to go around the world on the internet connection. And Dr. Steve over on the right here he's a healer. Everybody here, the technical folks in the back there, are helping this healing happen on a global level. Everybody who participated here and goes home and talks about it is part of this healing. So there is indeed good reason to be optimistic. We'll look back and look at the bad old days before plant-based nutrition got accepted, and we'll say, phew, finally the new day is dawn, and the physicians are allies instead of adversaries. So I'm optimistic, and I'm very grateful to be allowed to participate in this remarkable and very healing endeavor. There's a healthier future for us all if we just keep working at it. So be optimistic. Brighter day awaits.